Childhood asthma can be overwhelming for parents and can be difficult for children to deal with. Hi, I'm Dr. Vaneza Espino and I specialize in pediatric pulmonology. This is ManilaMed's Ask Our Doctors. Let me answer some of your questions about how to deal with asthma in children. So first, let's take a look at the questions from Twitter. At Mikey Not the Mouse asks, what is childhood asthma and how does it develop? Asthma is a chronic or a long-term condition where your airways are inflamed and get too narrow, making it hard to breathe. Imagine trying to sip your drink using a straw that is pinched. This somewhat mimics what happens to your airways when you have asthma. Asthma is a consequence of your genetic factors interacting with the environment and lifestyle of an individual. It can begin at any age, more commonly after the age of 5, but you may see similar symptoms in those younger than 5 as well. Next, from @LuckyMurphy, what are the common symptoms of childhood asthma? Common symptoms of asthma include chronic or your prolonged cough, usually dry. You have fast breathing, difficulty in breathing or breathlessness, episodes of wheezing or a whistling sound when breathing. These symptoms are usually associated with physical activity, may happen during a viral infection or after exposure to a trigger. Symptoms are also typically worse at night or early in the morning. Next, from @Crispin_BSL, what are the triggers for asthma attacks in children? And is there any way to avoid them? Asthma symptoms can be triggered by your respiratory infections, cold air, smoke, strong scents, exercise, allergens like your dust mites, molds, and pet fur, among others. Some of the ways you can avoid these triggers would include regularly washing your sheets, stuffed toys, and vacuuming of carpets. It is also important to educate household members to avoid and stop smoking cigarettes, and of course, always keep your child's vaccination status updated to decrease the risk of some infections that may trigger your child's asthma. Let's take a look at the question from @CuriousCat. Is my child at risk for asthma, and what are the risk factors? Your child is at an increased risk for asthma if they have a genetic predisposition, meaning if allergic diseases run in your family. Early exposure to tobacco smoke as well during pregnancy has been shown to increase the risk of your child to develop asthma. Let's now also take a look at questions from Facebook. Barbara Ann asks, are there any treatments for childhood asthma? Your child's asthma treatment plan will depend on how serious and how often his or her symptoms are. There are two main classifications for your asthma medications. First are your quick relief medications, which can be inhaled or nebulized. And you have your long-term controller medications, usually via inhalers. It is important to discuss with your doctor what type of medication your child will need and when he or she will need to use it, because improper use may lead to uncontrolled asthma and symptoms may get worse. So finally, from Christine Ramirez, is it possible for children to outgrow asthma? Young children who present with symptoms similar with asthma before the age of 5 may stop having wheezing episodes by the age of 6. For children truly diagnosed with asthma, their symptoms may be controlled enough that they don't require controller medication, but still be on the lookout because symptoms can come back later in life. So visit ManilaMed today and feel better with the best. Follow us for more health and wellness information.